Let's look at the importance of heartworm in dogs. Heartworm disease is caused by a parasitic worm known as Diarrhea immitis. In 2014, 0.5% of dogs in Ontario were affected by heartworm disease, and 80% of these cases occurred between Hamilton and Sarnia. Climate change may also be a factor for increased transmission, as heartworm needs warm temperatures to survive. Now let's talk about how heartworm is transmitted. A dog becomes infected through the bite of an infected mosquito. As the mosquito is blood feeding, immature larval worms are passed into the circulation of the dog. It takes about 7 months for the larva to mature into adult heartworms, which will produce baby worms called microfilaria. Adult worms can grow up to 12 inches in length and can live about 5 to 7 years in a dog. The cycle continues when another mosquito blood feeds on the diseased dog and ingests the microfilaria that is in the circulation. These will develop in the mosquito, and now this mosquito is ready to go and infect another dog. Once bitten by the mosquito, the larvae enter the dog's circulation and lodge in the pulmonary arteries where they begin to develop into adult forms. The pulmonary arteries are the vessels that leave the right side of the heart to take blood to the lungs to be oxygenated. This cluster of worms impairs blood flow and causes significant problems in the cardiovascular system of dogs. Normally, the vessels stretch and relax as the heart beats to accommodate the ejection of blood from the heart. However, heartworms cause damage to the vasculature, leading to thickening, hardening, and stiffening of the pulmonary artery walls. This means the vessels are unable to stretch as blood is pumped from the heart, which increases the resistance the heart has to pump against. Additionally, the worms themselves act as a physical barrier to the flow of blood, which further increases the pressure the right ventricle is pumping against. Consequently, the right ventricle is pumping against a significantly increased pressure. Over time, the increased work required by the right ventricle will cause dilation of the heart muscle, making it weaker, less contractile, and therefore less efficient. This eventually leads to heart failure, as the heart is not able to keep up with the demands of the body. In severe cases of heartworm infection, where a dog has a massive burden of the adult form, the worms will move into the chambers of the right side of the heart. These worms will block the tricuspid valve that is between the right atria and right ventricle, and block its normal function. This will cause blood to move backwards through the heart, further increasing the inefficiency. Dogs often show very few symptoms or none at all during the first stages of the disease. However, as the number of mature adult worms increases and the condition worsens, the resultant heart issues lead to many symptoms including chronic cough, inability to tolerate exercise, shortness of breath, and in more severe cases, coughing up blood and fainting. As the heartworms die, the dog's immune system will react by creating blood clots. These can lodge in the pulmonary circulation and can cause severe shortness of breath, as the blood is having difficulty reaching the lungs and potentially can lead to death. In most cases, initial detection of the disease is through a blood test that detects the presence of heartworm proteins in the circulation. In dogs that have adult worms present in their vasculature, echocardiography can be used to visualize the worms. A third diagnostic tool for severe cases of heartworm infection would be to perform an X-ray on the chest that will detect the enlargement of the heart. This tool, however, is not specific to heartworm, as there are other reasons for an enlarged heart, and so this should be used in combination with more specific diagnostic testing. Medications containing melarsamine are available for the treatment of heartworm infections. However, this is not a viable option in heavily infected individuals. If these drugs are given to a highly infected dog, many of the worms will die at once, and these masses of dead worms will stimulate a significant immune reaction, which will induce clots to form and move through the circulation. This has the potential to get stuck and result in widespread damage. Because of this, in heavily infected dogs, it is much rather preferred to surgically remove the worms. This is known as a worm embolectomy. In order to accomplish this, the doctor enters the circulation via the jugular vein and reaches the pulmonary arteries by passing a catheter through the right atrium and right ventricle. The worms are then pulled out by the surgeon to reduce the mass of worms and therefore relieve the symptoms of heartworm disease in the dog. Heartworm preventative medications containing moxidectin are widely available through prescriptions from your veterinarian. These medications prevent your dog from becoming infected with heartworm and should be used from June to October. This is when heartworm transmission is likely to occur, as these worms and mosquitoes require warm temperatures to survive. So remember, keep your furry family members protected by going the preventative route.